Very important to screen all the pregnancies if possible, and it's only less than 50% of the pregnant women that who receive the screening, prenatal screening in India. Uh, Before I start, I just want to explain that what is the difference in a screening test and diagnostic test. The screening test can only identify the pregnancies who are at risk of having a baby with a chromosomal abnormality, while diagnostic test confirms whether there is a problem or not. Now this is very important to understand. So first of all, we always offer the prenatal screening. Currently, there are three methods of prenatal screening that are available. Number one is a serum screening, in which we check certain blood biomarkers, and the other is ultrasound based. We check for ultrasound markers and can identify the babies with problem. And third, which is the latest one, is a cell-free fetal DNA test, in which we actually study the fetal DNA, free fetal DNA from the maternal blood. If you see, all these screening tests are non-invasive in nature, but we commonly call the last and the latest one, cell-free fetal DNA, as a non-invasive prenatal screening test. The only difference between these screening tests is that as we evolved, as we understood better about the screening, the first two has a lower detection rate as compared to this latest one, and has got a high false positive rate. When we talk about the high false positive rate, means there are certain women who will be labeled as screen positive although the baby is normal. When we say they are screen positive, false positive, they will go unnecessarily for the diagnostic test, that is an invasive test which has a minimal risk of procedure related miscarriage. So the benefit of this latest test, that is cell-free fetal DNA or NIPT test, is it has got a high accuracy with a high detection rate and a very, very low false positive rate. Hence, we can avoid lot of invasive tests to detect the problem. And the accuracy is quite high, so it is high likely that we will not miss the babies with the Down syndrome. That's the benefit of it. So far, currently, traditionally, I mean, we are using the combination of first two tests, that we add the maternal age, then dual marker, that is a blood test, along with an ultrasound. When we combine together, the strength of those tests also increases, and it in itself, it's a very good approach to offer that type of screening also. In our center, we do that, and then out of that, we identify that who are screen positive and who are screen negative. Those who are identified as a screen positive after combined screening, then we offer an IPT test to those women, and also we make sure that there is no structural abnormalities of the fetus on the scan. So this approach is also very good, cost effective, and has got a high detection rate and financially feasible at present.